Hi, my name is Ebro Casanova, and I'm going to present a case of a patient suffering from major depressive disorder. Okay, so the patient, a 32 years old woman, a marketing manager who reports feeling hopeless and constantly sad. She reports that these emotional states are a significant problem in her daily functioning, especially the aspect of motivation, as she finds it hard to leave her bed in most days. The living condition of the patient, as well as poor socialization, will be adding to her feeling of being isolated and can exacerbate her depressive symptoms. Another possibility of influencing her mental condition is her work-related stress as a marketing manager. Her psychological, social, and occupational stressor would be extremely important to explore to come up with an effective treatment plan. So here we have some subjective data. On chief complaint, I feel hopeless and sad all the time. The patient is 32 years old, gender female, race white American, occupation marketing manager. On the demographics, the patient lives alone and limited social interactions. Okay. Um, the patient, a 32 years old woman, states that she has felt constantly sad and uninterested in doing the things that she liked, and this lasted more than 6 weeks. Her level of depression is severe, as shown by the low mood score of 4 out of 10. She says that she cannot perform daily activities. Her sleeping problems, which are characterized by insomnia, are contributing to her lack of energy. The patient also experiences problems with concentration, as she can hardly concentrate on either work or personal matters. These symptoms correlate with the DSM-5 criteria of major depressive disorder, and this patient needs a complex treatment involving pharmacologic and psychotherapeutic treatment. The review of symptoms demonstrates several worrying symptoms such as the presence of severe fatigue, weight loss, and the lack of concentration, which aligns with the mood problems reported by the patient. Occasional nausea and loss of appetite could be gastrointestinal problems simultaneous with her depressive condition. Cardiovascular and respiratory systems seems to be not affected. There is no report of chest pain, palpitations, shortness of breath, or cough. The patient has no classical neurological symptoms such as dizziness, but she complains of headaches related to stress, which once again indicates that her physical symptoms are probably connected with her psychological distress. On the other part, we have hint, the patient denies any trauma, or, we already talked about dizziness. Last one, on the psychiatric, the patient has no thoughts of self-harming. The only thing is insomnia, and the patient is depressed. The patient has been taken centrally a selective serotonin reuptake inhibitor, 50 milligrams per day, which she has taken during the last 2 weeks. She also takes acetaminophen when she needs to manage headaches. The patient informs about non-drug allergies, and no adverse effect to her medication have been discovered yet. Given that she continues to experience depressive symptoms, the efficacy of sertraline will have to be reviewed and may be changed upon review by a more detailed examination. Addition of other pharmacologic agents or increase in the dosage of sertraline can be considered in order to handle the severity of her condition. The patient has a past medical history of generalized anxiety disorder, which was 3 years ago, and she was treated with hydroxyzine. Her medical history also includes asthma, which is well managed using inhalers and has not been experiencing any exacerbation in the recent past. No history of surgeries or hospitalization is present. Family psychiatric history is notable that in the depression and anxiety are present, as her mother and her father both had psychiatric issues. This can be an indication of a genetic component to mood disorders. No other significant physical health concerns are present, and her care complete focus can be made on her psychiatric symptomology. Also, the cousin has been diagnosed with autism, and the aunt generalized anxiety disorder. The patient resides in a one-bedroom apartment alone with little social contact, which may be adding to her depressive nature. She is a marketing manager, a job that is highly stressful and could possibly aggravate her mentally challenging condition. It is also important to note that she lacks a serious partner and a good family support, which further alienates her emotionally. She denies the use of illicit drugs, she is not a smoker. The absence of social support and the stressfulness of her employment may indicate that she should receive the intervention that will go beyond managing her psychiatric symptoms and ensure the social and emotional support. Laboratory tests of the patient, such as comprehensive metabolic panel and the thyroid functions, are normal, which eliminates other possible causes of her symptoms. The administration of the screening tool that include PHQ-9, GAD-7, and Beck Depression Inventory permits indicating the gravity of the mental health issues affecting the patient. PHQ-9 score of 18 indicates severe depression, whereas GAD-7 score of 7 points to moderate anxiety. The diagnosis of severe depression is supported by BDI score of 28. The tool will give you a clear image of the mental health condition of the patient and thus helps in coming up with a detailed planned treatment. Vital signs such as blood pressure 120/80, pulse 72 beats per minute, respiratory rate 16 breaths per minute, and temperature 98.0 on Fahrenheit are in normal range. All these findings indicate that the patient is physically healthy, although the patient appears neat. She looks tired, and these findings agrees with her depressing symptoms. She speaks at a normal rate and volume, however, she is slow to react, perhaps her cognitive slowing, which is part of her depression. Throughout the mental status examination, the patient was oriented to person, place, and time, but her judgment seemed to be impaired. It was difficult to make decisions. The evaluation of her progress should be carried out with further monitoring. According to the DSM-5 criteria, the main diagnosis of this patient is major depressive disorder, moderate. The client fits the diagnostic criteria as she has a constant depressed mood, severe sleep problems, and fatigue. She has experienced these symptoms throughout a period of exceeding 2 weeks, and these have seriously affected her capacity to accomplish daily chores. The patient grades her mood at 4 out of 10, which means moderately depressed. The diagnosis requires urgent care and treatment, and both pharmacologic and non-pharmacologic interventions should be offered to manage the intensity of her symptoms and enhance overall functioning. This patient is managed using pharmacologic and non-pharmacologic treatment plan. To begin with, the dosage of sertraline is going to be increased to 100 milligrams per day to respond to the severity of the depressive symptoms. In the absence of improvement despite 4 to 6 weeks, addition of mood stabilizers can be considered. Non-pharmacologic treatment involves referral of the patient to cognitive behavioral therapies to assist in managing their best thinking styles and encourage coping skills. Moreover, to enhance the overall well-being, regular physical exercise, good sleep hygiene, and mindfulness practices would be recommended. Follow-ups would be done in 4 to 6 weeks to review progress and to make adjustments in treatment.